Thank you so much, Genevieve. Well, over the weekend, a distraught Rio Linda family says they called 911 for help. Their schizophrenic loved one was armed with a knife, cutting himself and threatening suicide. Before the day was over, Christopher Gilmore was dead, shot by Sacramento County Sheriff's deputies, they say, after first trying to subdue him with non-lethal rounds. We're told those on scene turned to lethal rounds when Gilmore continued to advance without putting down his knife. With me now live is Kian Bliss with a group called Mental Health First, a group pledged to finding much better outcomes to situations like that. Kian, good morning to you.
Morning. Good morning, y'all. Appreciate you.
Kian, when you heard about what happened with Christopher Gilmore over the weekend, what went through your mind given what Mental Health First is here for?
One of the first things that really went through my mind is this was a man who was experiencing suicidal tendencies and was clearly calling out for help, especially when he's hurting himself and not really a threat to anyone else. But yet we responded with armed law enforcement officers who ended up shooting him because they were afraid of him holding a knife. These are my first question to ask really is, why is the Sacramento Sheriff's Department still responding to mental health crisis calls when we now have a 24/7 community wellness response team that is now tasked to respond to such mental health crisis calls without police?
Okay.
And the Sheriff's Department knows this. The 911 dispatch even reported that they knew the man was experiencing thoughts of suicide, and his loved ones had said he was in the bathroom harming himself, not anyone else. So I have to ask, why wasn't there an immediate and simple handoff to the CWRT team?
That is a question that lots of people are looking into this morning, as well as his family, and one that does deserve an answer when it can be isolated. Now, Mental Health First is a group that started 4 years ago, offering community response 3 days a week, Friday, Saturday, Sunday, taking calls from the offices of Transitions Clinic, 12 hours each day. How is that operation running now? Is it still those same 3 days?
Yes, we currently are available right now by phone support only, and we made this decision in order to keep our volunteers safe and healthy, and we're currently available Friday through Sunday, 7 p.m. to 7 a.m. And in the 5 years that we have been operating, at no point have we needed, when we are answering phone calls or responding in person, the need to call the Sheriff's Department or local police departments at any point. And we've now been able to expand our program out to Oakland as well.
And let me just ask, given the kind of scenario we're talking about here with Christopher Gilmore, when your volunteers have either been responding in person or taking calls, have they been up against a situation where someone was armed and family was concerned about them hurting themselves or hurting somebody else?
I can't speak to the specific instances of that particularly happening, but we have dealt with people on the phone lines who have been experiencing suicidal thoughts in similar fashion like Christopher Gilmore. And we operate through the lens of harm reduction, where we're trying to really just respect the autonomy and meeting people where they are, which is central to our approach. When we're responding to people who are calling us thinking of thoughts of suicide and self-injury, we try to be supportive and non-judgmental in their feelings, really remaining calm and avoiding expressions of shock or anger at these responses, and then asking the person to participate in safety planning, expressing concern for their well-being, and just asking them if we can do anything to alleviate the person's distress and try to refocus the cause of the person's need to harm themselves, and to help to de-escalate the situation. Because I think that's the most important thing is really, especially in these moments, is just to really talk to them without invalidating their feelings and judging them harshly, which oftentimes is what leads them to feeling these suicidal tendencies.
We now have 988. We have the 24-hour hotline that you mentioned that's in Sacramento County. We have Mental Health First. So why are we still here after a situation, do you think, like what happened over the weekend? Is the word just not getting out enough to people, enough to families that are, have loved ones, and there are many that have mental health issues, that there are other resources?
I think it has a lot to do with not getting the word out well enough. I think the county could be doing a much better job of promoting this far and wide. We should be having the community wellness response team's phone numbers, which has a direct hotline and the 988 line, available on billboards. It should be shared through every county supervisor's mailing list to constituents, as far and wide as possible. And we also it also needs to be shared by the sheriff's department. They themselves have come out publicly saying they do not want to be responding to these mental health crisis calls, and yet here they are. This is actually the second time they've responded to a mental health crisis call in a week with with an armed response. Most recently, the standoff that happened in Fair Oaks with over 80 officers from 4 different agencies at least showing up to respond to one person who people could hear on the dispatch asking for mental health services.
Okay, Ken, we're gonna have to put a pin in it there. It's a huge issue and a discussion that definitely needs to keep going. But we want to give out these numbers for Mental Health First. It's 916-875-1055. Thank you so much for joining us today. We also want to share the number for Sacramento County's community-based response to mental health crises. Again, this is for Sacramento County. It's 916-875-1055. And nationally, if you are feeling like you might take your own life, you need somebody to talk to, you can now call nationally 988 for help 24/7.